Good afternoon. I'm Peter Page. I'm the new Hospital General Director at Albany Medical Center, and I'm joined this afternoon with Mr. John DePaula, the President of the Albany Physicians Group, and we're here to give you kind of an update from Albany Med. And as John knows, we're kind of stepping in for Dr. McKenna. I know we can't fill his shoes, John, but we'll do the best we can.
Never fill those shoes, Dr. Page. But good to be here with you today, sir.
I'm excited. It should be fun. So if we can, let's get going with the COVID report, as we always do. We'll start with the COVID-19 6 a.m. census for the hospital. As of this morning, we had a slight downward trend the last few days. This a.m. we were 46 adults, 4 pediatric patients, 13 adults in critical care units and 2 pediatric patients in critical care units, and actually 4 adults on ventilators, 1 pediatric patient on ventilator. Just as a little frame of reference, 1 week ago we were at 58, and 2 weeks ago we were at 49. So we've actually dropped over the past week for inpatient COVID hospitalizations and pretty flat from 2 weeks ago. I just want to remind people that inpatient hospitalizations for COVID aren't necessarily because of COVID, but can be incidentally COVID. And we are seeing that with a fair percentage of our inpatient population. The next slide we'll look at daily hospital admissions by vaccination status. You see the black line, that's vaccine effectiveness. And you'll see that right now we're at 90%. And that's pretty flat. And this is really to prevent hospitalizations, not to prevent cases. And we'll talk a little bit more about that in the next slide. The blue line is hospital unvaccinated patients, which is up slightly to approximately 20 per 100,000 admissions. And then the red line is hospital vaccinations. That number is pretty flat, very low, but it just speaks to the fact that the vaccines and the boosters are so important in preventing severe disease, hospitalizations, and death. And obviously now the vaccines are available for anybody 5 years and older. And actually right now they're considering vaccination safety for 6 months to 5 years old. And that's actually going to the FDA for review on June 15th. So great news on the vaccine front, John.
That's great news, Peter. And obviously it works. So the
no
more
question.
people we can vaccinate in all age groups, obviously the better off we all are.
Absolutely the best treatment option, prevention. New daily cases by vaccination status. This is 18 and older population. The black line is vaccine effectiveness. As it's been running, it's just below 70%, slightly downward trend. And the blue line is new cases per 100,000, approximately 200 in the unvaccinated population. And the red line is new cases per 100,000 for those vaccinated. Again, very low numbers. And remember that as we've heard Dr. McKenna reference on prior occasions, you know, with these new mutations and increasing variants, the transmissibility of this virus is increasing. So we expect cases to continue to be high. But obviously our goal is to prevent severe disease, hospitalizations, and death. The next slide, one of my favorite slides, is actually the variant slide. As we've talked a lot about in previous episodes. And currently right now, BA2.12.1 has taken over as the dominant variant in New York State, up to 67%, with BA2 being 31%. A comparison for you, across the U.S., we're at 58% BA2.12.1 and 39% BA2. So we're a little bit more slanted towards the BA2.12.1. Additionally, you might hear word about BA4 and BA5. These are new Omicron variants, again, more transmissible. They probably have some component of immune escape. However, there's not been a link at this point to increased severity of disease, hospitalizations, or death. Right now in the United States, we've had 181 cases reported of BA4, 22 in New York State, and for BA5, 129 in the U.S., and 9 in New York State. A lot of those in New York State have been identified in New York City. Next, we'll go to all regions. New York State, total COVID patients hospitalized is 2,653, 13.39 per 100,000, really flattening out across the state. And then next, we'll go to the capital region specifically. The total COVID-19 hospitalizations, 188, 18.61 per 100,000, and that's actually trending down, but it is still early based on the data. But some positive news coming out of the capital region, John.
Yeah, Yeah, it's hard to believe, Peter, 2+ years later, and we're still reporting on the COVID statistics and trends. But like you said, hoping for the best this summer and continued decline with COVID.
Yeah, and I think that the vaccinations have changed the playing field, and I think we've learned so much about not only the virus, the vaccines, but also how to manage patients, that we've really come a long way in 2 years. But it's been a very challenging 2+ years.
It certainly has, sir.
I wanted to cover one other area, employees out with COVID. We talk about this a lot. We've been running in that 140 to 150 number on a daily basis, and I do think it's important to be aware that this number staying flat is really critical, and we need to bring employees back as soon as we can once they're cleared and follow the protocol. And I wanted to recognize a few people that have really been instrumental in our ability to clear these patients appropriately and get them back safely to work to help us maintain the staffing that we currently have. I want to recognize Dr. Monge and Karen Lovell from Employee Health Services, and Megan Keenan and Cindy Novak, part of our quality program, who have really gone above and beyond to make this a 7-day process to try to ensure employees getting back as soon as possible.
That's a great call out, Peter. And as we've done senior leader rounding and we've run into some of our staff who in fact have had COVID and have come back to work, those staff members have been very complimentary of those individuals that you've called out, have really taken a balanced approach with them and helping them get back to work when they're feeling much better and ready to go. So it is an important role that they're providing for us.
And with so many people testing positive now in the community, it's natural that our employees are going to get it.
Right.
And so the key is really instrumentally trying to get them cleared and get them back to work.
Absolutely right.
We want to switch gears a little bit and talk about some great news, actually. Our system strategic plan is up, operational. It's carrying us through 2022 to 2024. It was a great collaborative effort, significant input from all sites, obviously stressing our two big priorities, our workforce and our ERP, EMR implementation process over the next several years. There are 6 important underlying strategies which go along with, obviously, our mission, vision, and values. The first area is the consumer. Second area are really our people, our workforce. The third is preferred. We really want to be the healthcare destination of choice, and we want our practitioners to be the healthcare practitioners of choice. The fourth is value. The fifth is education and discovery, really trying to promote our medical education opportunities as well as other staff education as we continue to promote from within. And then the last is collaboration, and that really speaks, strategically to what we're trying to do as we, continue to integrate and improve upon our system position. And John, as we talk about, workforce is such a critical part of this whole process, why don't you tell us a little bit about some of the activities going on now?
Will do, Peter. Calling out workforce first, we've had some success very recent. In fact, yesterday we had a job fair for targeting LPN staff, and Emily Wright led that charge. We had a team of people, human resource representatives and some other support staff there, and we had some tremendous results, sir. We had roughly 20 new grad LPNs sign up to work with Albany Med. Right on the spot, ready to go. Again, like I said, Human Resources was there to kind of work through all the paperwork. So we have 20 new LPNs as of yesterday joining the Albany Med physician practice. 4 others actually committed to joining us as well, and we're working through some issues with them. And we actually got 70 other LPNs that were interested in kind of working on the hospital front. So a tremendous day, a tremendous job fair. Great teamwork, lots of success, and that really comes off of really a couple of months worth of recruitment that we've been doing on the nursing front for new grad nurses. And Peter, you gave me the number earlier today. It's remarkable. I mean, we're at over 300 new grad nurses that have committed to come working at Albany Med in the coming weeks. A lot of them have already started and begun work as they wrapped up their programs, their nursing school programs, in early May. So, and it really is starting to show. We have a weekly orientation, new employee orientation process that we have all of our new employees go through. A bunch of us, including Dr. McKenna, were there on Monday to kind of meet the new staff. And our large auditorium, ME 700, was pretty much filled with new employees that were going to be start working across Albany Medical Center. So really a lot of success that we've had recently with recruitment, and as you alluded to, Peter, it's top priority in our strategic plan is our workforce. So some really tremendous success that happy to report to you and others.
You know, it's great to hear all those updates. It's such a critical part of what we're trying to do and where we're trying to get, and to be able to provide the care that we need to provide that we're in such demand for. And to see so many people's efforts in this regard is really great to see and great to hear about. But it's also important for us, as you alluded to recognize the people that have been so instrumental in some of these successes. In follow-up to that, I did want to talk a little bit about our wellness journey. We have a great wellness committee, a great wellness team, and as we talk about our workforce, it's so important for us, to support our workforce and try to keep our workforce happy, and being able to balance that personal and work life, and really feeling good about their job and what they're doing. And this wellness task force, led by Kathy Palazzi, Jeff Davis, Mandeep Sadhu, they have so many people working with them. It's just it's really a phenomenal group, and they're doing a lot of interesting things. And the thing I like most about it is that they're constantly thinking of new ways to improve wellness and morale for the staff. Some of the examples, try to keep the staff relaxed, unwind a bit, meditation options, yoga options. They've talked about massage therapy. They've also even started promoting events coming up over the next few months, including farmers market, food trucks. They're constantly looking for mental health support for anybody who needs it, who reaches out. Such a critical part of our, two of our 3 R's with retention, recruitment, retention. But we have to constantly be looking at this and promoting this going forward so that we can do the best we can in that regard. But thank you. For the next piece, I'm going to turn it back over to you, John, and have you give us a little update on 518 Day.
Yes, sir. So 518 Day was yesterday, and it was a combination really of the United Way and Double H Ranch really kind of working together in the community and really trying to gather volunteers to help with community projects. And we're happy to report we had a significant turnout of Albany Medical Center staff that volunteered for these projects. One of the primary projects was actually at the Double H Ranch. We had a lot of our staff help with basically preparing the grounds and the cabins to be ready to house children that have medical challenges that go to summer camp up at the Double H Ranch and have a very worthwhile experience. And obviously, in order to kind of facilitate that, you got to get the grounds ready, you got to get the cabins ready, and really a strong turnout, as always, of Albany Medical Center staff volunteering to help with these community projects.
An amazing work that the Double H Ranch does on a continuous basis. So proud of all the support they get from Albany Med. It's Memorial Day weekend.
Yes, it is.
A couple little known facts, perhaps, about Memorial Day. When Memorial Day was originally conceived, it was actually called Decoration Day. It was called Decoration Day following the Civil War, where it was really an encouragement for people to place flowers by the graves of their lost loved ones that died, obviously, in battle. And over the course of the years, it wasn't until after World War II in 1967 that it was proclaimed an official federal and recognized as an official federal holiday. And obviously, it's kind of the unofficial start of summer, so it's a big weekend. For all those who have the weekend off, please take some time to relax, enjoy time with your family and your friends, be safe. And as we always say, or as Dr. McKenna always says towards the end of the video, we really are encouraging people to take care of themselves. We really appreciate all you do every day, not just this weekend, but we really recognize your commitment this weekend as we continue to try to provide the best care we can for our communities.
Absolutely, Peter. And again, I think your Memorial Day call out is a good one. A lot of us have holiday traditions, but remembering those and taking a moment to remember those that made the ultimate sacrifice for us is something that we should all consider.
And those that are still out there and, helping to protect our country, our rights, and everything, the U.S. stands for. So are you doing anything this weekend?
Nothing special. I've got a lot of mulch to spread this weekend. That's what I'll be doing.
I've just got to cheer for the Boston Celtics.
There you
tomorrow
go.
night. So, well, thank you, everyone. Thanks for watching. Have a great weekend, and we'll see you next week.